So can you tell me a little bit about how you first became involved with the college?
Well, you first become involved when you're a resident, because residents are members of the college, and that goes back to 1975. And I did my training, my medical school and residency in Toronto. And Reg Perkin, who was our executive director 2 ago now, was head of the residency program and was personally a mentor to me. So that's really where I started. And I finished residency in 1977 and started practice at that time. So I'm celebrating in my year of residency 40 years as a practicing family doctor. I think my biggest involvement was early on. Well, there were a couple of things. I was awarded the Murray Stalker Award. As a resident. You get that in residency or as a graduating resident. And the prize was to go to FMF and do a presentation. And the presentation was on the periodic health examination before there was a periodic health examination task force. And so I remember presenting that at FMF. So that was one of my key involvements early on, and there have been a number since then.
You've been a family medicine educator since you entered practice. How has your involvement in education shaped your career?
It really has. Going to Sioux Lookout, I went with my wife, June Carroll, who was also a family doctor, and the two of us were half the medical staff at what was called at the time the Sioux Lookout Zone Hospital, the hospital that provided care to the First Nations communities that really were from Sioux Lookout north all the way up to Hudson's Bay. At the time, the Sioux Lookout project was a project of the University of Toronto that had partnered with the federal hospital, providing that care to the Indigenous population to try and improve the quality of care. And so U of T was responsible for recruiting the family docs who staffed the hospital and did the fly-in service, like me and June, and also sent up residents in family medicine and in pediatrics and in a few other disciplines. And both of us had gone as residents, which was our connection and why we were recruited up there. And so subsequently we were involved in teaching the residents and students who came through that project. And so I think I had always seen that as just part of what you do, like back to the Hippocratic Oath, part of what you do as a physician and specifically a family physician. And doing it in Sioux Lookout was a great way of maintaining that connection with the University of Toronto and with that whole enterprise and making it part of trying to improve care in the North.
So supporting family physicians in providing comprehensive continuing care is a priority for the college. What are some of the challenges and opportunities you see in advancing this issue in the coming year?
So that really is, I think, it's multifaceted, and it really is a challenge and also an incredible opportunity. Comprehensive continuing care is the foundation of primary care, and in Canada, family doctors are essential. I would say kind of the cornerstone of primary care in this country. That said, one of the wonderful things that's happening with the patient medical home concept is the primary care team is being developed. And so family doctors who used to work solo or in dyads and providing a great service now can do that in a much more robust way with primary care teams that include obviously multiple physicians, but more important than that are multidisciplinary. The challenge there is how one looks at continuity and how one looks at comprehensiveness. There's a little more clarity around continuity in terms of some of the research in this area. There's continuity with an individual who's the primary care provider for a patient or for a group of patients. In other words, that's who the patient usually sees and relates to, and that's the patient-physician relationship, which is one of the principles of family medicine. So in continuity, there's the continuity with that individual. There's also team continuity, because nobody can be available all the time and nobody can provide all the services that one person needs. And that's where a comprehensive from a team approach comes in as well. And in a team approach, including physicians who may have areas of expertise or added competence, as we call it, the issue is how to appropriately integrate that. The college has done, in my view, a great job of adding certificates of added competence. I was actually, another early involvement with the college was helping to launch the emergency medicine certificate that Cal Gutkin headed up, and I was at the Western and a young faculty person and helped with that. I was an examiner for the first exam ever. That's been a great service to the profession in terms of enhancing skill and certificates that are recognized. That said, are we serving the needs of communities if people are doing those areas exclusively? And what's the role of someone who does palliative care exclusively, or sports medicine exclusively, or emergency medicine exclusively? Is our ideal that people are comprehensive physicians with a group of patients they look after and also do these things? We know that's not always the model. And so looking at a way of incorporating physicians and allied health who have particular areas of focus and expertise and things that they bring to a team, incorporating that into a patient medical home model, I think is one of the challenges. We haven't worked that out yet. We don't know exactly what that looks like. There are different models. It also has to resonate with how people feel about what they do, what really engages people, and how people will work together.
So what are you most looking forward to in your time as college president?
Most. Probably the biggest thing in this country, and something you start to experience as a board member and president-elect, is the opportunity to meet with family doctors from across the country and look at how primary care and the patient medical home is being implemented across the country. We have a lot to learn from each other. People are doing amazing work. So to be in that role and to have that opportunity and to help make those connections and share some of the ideas that, people are really struggling with something in this location, but over here they've really worked out a great way of going about it. That really is very exciting. I'm not a huge fan of airplanes and airports, but the people connection is really exciting.